Welcome back to the show, folks. Can you believe it's September? Wow, where did the summer go? Well, I'll tell you where it went. It's behind us now, and we are launching into almost the last quarter of 2024. What a year it's been. This podcast has grown like crazy, and I have all of you to thank for it. So thank you for your presence. Thank you for your comments, the reviews, the whole nine yards. It's been an incredible year, and I'm looking forward to a lot more. Today's episode will not disappoint. But before I jump into the episode, as you know, we want to thank our sponsors. We have a few great ones today, as always. And also, I'd love to encourage you to sign up for my newsletter, and especially now, because these days, when you sign up for my newsletter, you get a 7-part series email. So it's 7 emails that come delivered to you over a few weeks. And where in that email, I describe how I coach my clients on laying the foundation in their health practices, both diet, nutrition, all of the different things to prepare their body for more advanced health optimization strategies to achieve a long, vital life. And of course, what we're doing is we're trying to prepare the body to receive things like whether it's bioregulator peptides, certain supplements or practices, we must get those foundations in place. And so that's what that email strategy is about. So if you're not already signed up for my newsletter, please make sure you go to natnidham.com. Red bar at the top, sign up for the newsletter there. And that way we can also keep in touch. All right, let's talk about this episode a little bit because I'd love to frame it for you. So here's the thing. You may not realize it, but poor posture can impact everything from digestion to mood and even ultimately to longevity. In this episode of the Longevity Podcast, I am joined by posture expert Annette Verpillot, or Verpillot, as some people might say, to discuss how our alignment, starting from our feet, affects our entire nervous system and brain function. We dive into how posture is connected to the brain-body connection, its effects on various aspects of health, and the importance of working on the nervous system to improve posture. And you're going to be fascinated by the strategies that Annette has developed. It was nothing I'd ever heard of before personally. So we even discussed the negative effects of wearing, of course, improper footwear, practical tips for improving posture, including, little spoiler alert here, eye exercises, as well, of course, as stress reduction and even, get this, proper tongue posture. Who knew there was even such a thing? Annette Verpillot is the founder of Postural, a health company specializing in restoring the brain-body connection. She's a Canadian entrepreneur, therapist, public speaker, and internationally recognized posturologist. Annette's developed some of the world's most advanced rehabilitation and injury prevention techniques, and she teaches a method called the Postural method to professionals in various fields. So to find out more about Annette, you'll want to go to her website, which is posturepro.co, and also follow her on Instagram under @posturepro. And now let's jump into the episode. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome to the show, Annette Verpillot? How do I say your last name? I should have asked you that before we started.
Thank God, it's pronounced in French. It's
Verpillot?
Oh my God, do you speak French?
I do.
That's amazing. I don't know if you want to say it in French. Verpillot. I know that the English-speaking people have a harder time pronouncing it. I think in English would be pronounced Verpillot. Does that make sense? Verpillot.
Sure. Okay. Well, welcome to the show. And it's a pleasure to learn that you're also, are you French speaking as well, or you just have a French last name?
I am French speaking as well. I'm my origins are from France, but born and raised in Canada, Montreal.
Oh, nice. Interesting. I'm from Montreal as well.
Oh, well, there you go. That's wonderful.
Yeah.
I don't know if you're where the heat is, but at least it's, better, usually better where it's warmer.
Oh, I'm in Toronto. So I find Toronto is usually a little warmer than Montreal. It is. It's always a bit warmer. And being Canadians, we're obsessed about weather. So that's right, people. You're listening to a longevity podcast, and we're actually talking about the weather. Um, I think we're going to stop that right now. And what we're really going to talk about is, in many ways, I think what we're talking about today is mind body connection and how the physical impacts every piece of our health, both emotional health, mental health, and physiological health. But before we jump into that, um, maybe a few decades ago, you would have been the lady teaching people to walk with a book on top of their heads to give them good posture. But I'd love if you would talk a little bit about how you came to be the posture guru, and building all these bridges between what is good posture and its impact on really deep aspects of health that I think we really underestimate.
I came to be a posture specialist simply from failure as a rehabilitation specialist. So
Mm.
my success came out of learning experiences, really, which is where I had started noticing, questioning already, but noticing that in practice I was not able to obtain long-term results with my clients. So one thing led to another, and putting two and two together, the nervous system, the body. Let's start incorporating that into the context of rehabilitation, and let's see how people feel. Can we accelerate the process? Can we speed it up? But most importantly, can we make it last long term? Which for me
Mm.
meant two things: better success rate, and unfortunately less sessions, less less in clinic sessions, which actually turned out to be a really positive thing, because it led me to where I am here today.
Yeah, no, that's amazing. And so you were doing, was there a specific population of people that you were working with, or were you just like anybody who needed any kind of rehab, be it from accidents or injuries?
Yeah, general population, although at the beginning I was introduced fairly quickly to heavy conditions like Parkinson's disease and stroke, and whatnot, or cancer, surviving cancer patients. But I'd say the main population was general population, and now a lot of athletes, state police, and children. I mean, I love to work with children, because if we're talking about true prevention, it really does begin. The sooner you catch these issues, the better off and the faster off you'll be resolving them.
I love it. So here I am interviewing you, and I'm very conscious that I'm sitting up straight, and my shoulders are back, and my ears are over my shoulders. It's pretty funny how, in context, when you're in conversation with someone, all of a sudden you're like, "Oh, am I doing this properly?" So, okay. So, what did really your main jam is this whole. Well, I guess we're talking about it through the lens of proper posture, but it's about the brain body connection and its effect on overall health and wellness. And so maybe do you want to talk about that a little bit? This whole concept that, we think about the physical body as being the thing that we have to worry about, but we often forget about the brain or the mind. And I'm wondering if we're going to talk any at all about how emotions can actually affect posture in a particular way that sets people up for negative outcomes.
Yeah, so when we talk about posture, one has to think about the brain. And going back to your first question, not talking about the brain in the context of whether it be rehabilitation or just longevity and global wellness, I think is a massive missing link in the industry. People, and certainly when I say people, I mean specialists in their fields and just general population, don't realize that by working on the nervous system, you can have an effect on everything. So if we're
Mm-hmm.
talking about musculoskeletal disorders, are we talking about hormone production? Are we talking about stress level, digestion, sleep? When you address posture, you have an effect on a part of the brain, which is the ancient primitive brain, which is called the brain stem. And if you
Mm-hmm.
have an effect on the brain stem, you're going to affect in return the entire brain. So of course it's going to depend on who we're dealing with. Are we dealing with an adult? Are we dealing with a newborn baby? Are we dealing with a toddler? Depending where you are on the spectrum will dictate the speed at which you should expect getting those results. If you're dealing with someone that has neurological disorders like Parkinson's disease or whatnot, all of these things will interfere. But globally, all in all, when you work on the nervous system, you will improve it to a certain degree.
So you mentioned infants and toddlers. So I'm curious about that because I think that, anyone who's had a child, at some point you always notice, wow, when that child first learns to sit up, they're sitting right up, right? Their back is super straight. Maybe it's a little hyperextended. I mean, I'm not an expert in the area, so you would know better than me, but they're because they're working, I think, so hard at stabilizing themselves, and they have to work so hard to stabilize themselves even when they learn to walk. Their posture is quite good. So in what world are you kind of working with infants and toddlers? Like, is this because they were born with certain issues, or is it the kind of thing that you think parents should have an eye on?
Yeah, well, I think parents should have an eye on neurological development to begin with. When we're born, we don't have the ability to walk. It takes actually 12 months for a human to walk, whereas it will take a giraffe 5 minutes.
Yeah.
The difference between the two is that the brain is still very plastic in a child. The connections from the body to the brain, if I may express it this way, have not yet been are not mature enough so that the child is able to control their own movement, their muscular movement. And this is why children kind of look weird when they begin to walk, because that full development really happens in different stages. But from 0 to 12 months, there are primitive reflexes, which are basically automatic, for your listeners, are automatic movements, uncontrollable movements that are inhibited by the brain, specifically the frontal lobe. So what children must learn to do is to inhibit these involuntary movements and reflexes through the activation of their brain, the frontal lobe, that will inhibit that involuntary movement. And that happens through primitive reflexes. So from 0 to 12 is when we developed, last they identified were 72 of them, which will teach us how to walk and stand. And then from 1 year old to 8 years old, the child or the toddler will learn to balance themselves through, contralateral movements with head, shoulders, and pelvis synchronicity, so that we can walk in an upright posture. So those different stages are constantly happening, or are happening anywhere between the age of 0 to 8 years old. But for me, I think the most important period will be from 0 to 12 months, because this is where those 72 reflexes need to be fully integrated. And there's
Hmm.
different stages that you can relate to different parts of the brain, but at the end of the day, it all comes down to movement. Movement is what activates the brain, but in order to move, you need to feel where your body is in space. And in order to feel your body, we're equipped, when I say we, humans are equipped with sensory receptors that will tell our brain where our body is in space, so that we can build our brain, or the building blocks to the brain, to inhibit those reflexes, to ultimately reach the highest level of intelligence, which is frontal lobe development. Now, where this
Hmm.
becomes interesting, and if we talk about that later, is that one of the functions of the frontal lobe is to inhibit the limbic system. So our
Right.
ability to control our stress comes directly, or is directly influenced by our frontal lobe, which is influenced by the integration of primitive reflexes. So when someone comes into the office, let's say 33 years old, they've suffered of lower back pain. This is a biomechanical problem, but it actually goes back 32 years, because if they have back pain today, and we're going to exclude injury, they probably have retained primitive reflexes and other symptoms that are associated to the reason they're consulting me today.
Wow. And so is there anything that parents should be doing with their zero? Because, I think for the most part, we trust that early childhood development, it just happens, right? Like babies as you say, like they look kind of drunk, slightly spastic, and over time the movement refines, they get better, they're less likely to punch themselves in the head when they're trying to put their fist in their mouth. Like, they start to get better at, they refine their motor skills, if you will. But are there things that parents should be thinking about or doing that can help their children, or are there signs we should be looking for that says, maybe we could help? Because it just seems some people come across as more coordinated than others. And I'm guessing that the less coordinated people, you might say, have retained some of these primitive reflexes, like they never really worked them out as infants, and so have carried them on as kids. Like I used to say I never came across a set of stairs I didn't fall down when I was a small kid. Like I just kept falling down the stairs, which probably didn't help much. But like, is it possible that there's things that we could be doing as parents of young children just to help them, or should we let nature take its course and just be watchful of signs that maybe they do need assistance?
Well, it's just in the era that we live in now in 2024. I think that a lot of the things that are being done to newborns is actually preventing movement. So we try to protect them because we're afraid that they're going to fall. So we kind of restrict the movement from the moment a baby is born. We wrap them up really, really quickly in a tight. So with the first thing that the child, there are things that parents can be looking or doing, which is basically promoting movement. Skin to skin contact is extremely important at the moment of birth. But before we even talk about birth, I'd say we need to start with the mother. We need to make sure that the mother's pelvis is completely aligned so that the pelvis can outflare and accommodate the passing of the head of her child. And that is one thing that is, and this is important because the activation, the movement of the head that the baby does at the moment of birth is a trigger to the child's nervous system to let them know that the child is no longer in the womb, and tell the nervous system, hey, start moving. So when that trigger is non-existent because of, for example, complications or cesareans, if there's a complication, it's understandable. But if there is a way to have a natural birth, as much as possible, and I sympathize with women. I mean, I'm certainly not suggesting that we should be in labor for 45 hours. But what I am suggesting is that there are things that you can do to make sure that the process is as quick and as smooth and as painless as possible, to ensure that the development of that baby is as optimal as possible through that entire procedure. So working with women first, making sure their pelvis is aligned. When the baby's born, making sure there's the activation, no twisting of the head, no forceps, ideally, natural birth, and movement promotion, starting to promote movement as early, immediately. Skin to skin contact movement. I mean, you see children will start raising their heads at a month and a half.
Yeah.
And the raising of the head will activate, the muscles of the neck. And that is going to activate the vestibular system, which is the inner ear, that's going to activate a very specific part of the brain, which is the cerebellum. I don't want to sound too technical, but the cerebellum is what is going to activate all of the intrinsic muscles of the spine, so that the baby can now start to learn to stand upright. 12 months will learn to stand upright and start moving all the way up to 8 years old. So it goes in stages. And when I work with children, it depends on which stage the child is at, how old are they? And then there's different things that we can do, all with the same purpose, to promote and activate to promote sensory input to improve proprioception, which is awareness of self.
Yeah. No, I got it. Okay, cool. Well, that's interesting. So that's beginning of life. So now let's jump ahead a little ways and move into the adult world. And let's talk a little bit about, because you use the word posture, and when you see people walking down the street, I'm sure you must go nutty. I mean, you see all kinds of stuff, right? Like people, whether they're hunched over, hyperextended back, kind of a little bit wonky. So, let's talk a little bit about your space and what you're looking at when you're looking at posture, and how that can affect different aspects. Like in one of the topics that you sent me for our conversation was the impact of posture on hormones and mood, and or the relationship between posture, hormones, and mood. I don't know if it's impact or relationship, but maybe let's kind of dive into that a little bit, because I think that that's a really interesting topic. And for me, I know that sometimes you can tell how someone's feeling just by the way they're walking or the way they're holding themselves in space. And I don't know if that has anything to do with your space or if that's part of the whole science of it.
Well, of course. So let's go back to what you just. So when I look at someone just simply walking, just someone's gait tells you a lot about their nervous system. The way that somebody walks and stand is a direct reflection of the way that their brain is functioning. I'll give you an example. In Parkinson's disease, they tend to have a flexor dominant. Their entire body kind of moves forward. The terminology for this is captocormic posture, where the body, they're unable to inhibit flexion and activate extension, and slowly, they start moving forward. So that's a
Yeah.
direct reflection of that brainstem that we were talking about earlier with primitive reflexes. So when you look at someone who has struggled just with their gait, the way that I perceive it is that there are two fundamental components that allows us as humans to be able to move in our environment, and that is going to be the contact with the ground. So that's going to be the way that our foot lands on the floor and the way that we've learned to distribute our entire body weight as we're juggling from one limb to the other, and the way that we're scanning the environment. So the two
Mhm.
main, I call them sensory receptors, for me are the feet and eyes. So the
Right.
first thing I'm going to look at is the foot and the eye. And if someone's gait is compromised, well, I know from experience, I mean, I've been doing this since 2006, and I've yet to see someone that has posture problems, gait problems, or pain problems that doesn't have an imbalance with their feet and eyes. It just doesn't exist. So if the
Interesting.
input going into the brain is asymmetrical, the output will be compromised and will be asymmetrical. And this could be seen as someone saying to you that, when they take a selfie, their head is always tilted on one side, or they've noticed that their shoulders are moving forward or tilted, the pelvis is rotated, they're flat footed, but one foot is more flat footed than the other. All of these postural symptoms um, um, manifest themselves in different ways. And in living in healthcare, we associate these problems to, oh, it's just normal and part of aging. It actually isn't. It's a
Mhm.
direct reflection of your brain that's aging. So if we're going to talk about longevity, what can we do to prevent aging as best as we can? I mean, we're already trying to reduce stress, we're eating right, we're trying to incorporate different lifestyle changes into our everyday life, but no one's talking about posture. They
Mhm.
just associate posture as, oh, I'm going to stand up straight. You can't think yourself out of poor posture, because it's simply controlled by the parts of the brain, the same parts of the brain that control heart rate and digestion. So unless you
Interesting.
want to spend your entire life thinking about your posture, I mean, I think that there's, we could think of many other ways to dedicate our time and energy to much more important things, as opposed to just constantly thinking about your posture. And you can do this by simply improving the input from your foot posture. So that's the skin of your foot, and by incorporating very easy eye exercises to activate the eye muscles that feed into the brainstem, which is again that same part of the brain that we keep on talking about, that develops at the beginning of life and activates the entire
Mhm.
brain.
So, okay, so going back to someone with Parkinson's disease, there's two. I mean, I've known a couple of people, sadly now, with Parkinson's, and there's the forward flexion you were talking about, where they kind of start to curl in on themselves, kind of thing, and then there's this shuffling of the feet, so they're no longer able to pick up their feet and move through. Is there, when you're working with people like that, are you able to help them to re-engage their nervous system? Because I mean, ultimately there's a problem in the brain with dopamine and and that kind of thing. But is there a possibility by working at it from a different angle to help people stave off or slow down the progression of what's happening with them, and then let's move into a non-disease state, like.
Yeah, so that's the idea. The idea is to delay the symptoms as much as possible. We know that there's a genetic component with Parkinson's disease. We know from published studies that were done with Parkinson's patients that just simply dancing, just dancing helped with the symptoms or reducing the symptoms of Parkinson's because movement activates the
Mhm.
brain. So when you dance, you have to learn to re-coordinate your body as your partner is moving through space, which involves the vestibular system. So the part of the brain involved in Parkinson's disease, we're not going to get into that too much, is the basal ganglia, but it is an area that does that is involved in dopamine production. But working on your posture activates the frontal lobe, and there are receptors in the frontal lobe that do secrete dopamine as well as does eye movements. So I've seen many times a reduction in symptoms with depending on which stage they are, but I've worked with stage 4, and the results are staggering. I have
Really?
video. Oh yeah, it was just his name was Xavier, and he did give me permission to talk about him and videotape him. Came into my office walking with a cane, and you literally saw the lag of one of his limbs, of his foot, unable to lift the leg off the floor. And we repeated this several times. I work with therapeutic insoles, which are basically using a frequency to stimulate the receptors in the skin to activate those brain parts. And just putting those insoles in his shoes and working out with different eye exercises, the before and after in the session is completely unbelievable. One would not believe. And a
Wow.
month later, he's walking in the office without his cane.
Really?
Oh yeah,
And
yeah.
this is a degenerative condition. Like, that's impressive.
This is stage 4. So
Wow.
I'm not unable, of course, to guarantee that I will get these results with everyone,
Mhm.
but this is something that we see and that varies on different spectrums, what type of medication or what type of stress level, what type of life, all of these things, those variables will affect the outcome. But if we can have, by working on posture, the conclusion of this story is that by optimizing the nervous system, even with a condition that affects the nervous system, you can have really, really amazing improvements. So now, if we're talking about general population, someone who does not
Mhm.
have a disease of the nervous system, working with athletes will be the top, working with kids will be great, and anywhere or anyone in between, we can expect the same types of results. The idea is prevention. No one is
Mhm.
really paying attention to prevention unless they're into competitive sports.
Yeah.
Unfortunately, right, in healthcare, no one's talking about prevention. Well, prevention is key. If what you do today, I mean, we're eating right to prevent heart disease, to prevent obesity, to prevent, right? So why are we not doing the same thing when it comes to taking care of musculoskeletal disorders? I don't know.
Yeah. Well, I mean, I think awareness is a big piece of the puzzle. And so for those of us who are not performance athletes, but so actually let's take this to another place. You get people who are doing, pick a sport. Let's say they're doing CrossFit, or they're going to the gym and they're doing interval training, hit training, or whatever, what have you. And who was it? I was just talking to someone recently who said, "Oh yeah, you know what? I've kind of," and this is a woman who actually, she's maybe in her mid 40s, and she looks fairly fit, but I've never been in worse shape because every time I start to exercise, I get injured. Something goes wrong. And so I'm wondering, when you hear that from someone who doesn't actually, there's, to look at them, they look great. But they say that no matter what they do, as soon as they get into something, they end up with some kind of injury. Does that say to you, I'm going to guess the answer is yes, but is that going to scream to you, there's an imbalance in the nervous system? If we can help to re-engage the parts of the brain that maybe are not being triggered properly, then all of a sudden everything's going to come back into place.
Absolutely, absolutely.
And you can
That
say that in a much more sophisticated way than I just did.
no, no, absolutely. You've nailed it. Listen, there's only one hallway that you can go through to move your body, and that is a part of the brain called the motor cortex. So if by using your body you immediately trigger pain, it simply means that there's asymmetries with every one of your joints that you are exposing through movement.
Yeah.
The ones to feel pain and get injured the fastest are athletes, which goes back
Mhm.
or stresses the importance of working with methods that are preventative through posture assessment. Doing a postural assessment or consulting someone that will assess your posture and intervene on all of the sensory receptors at once is what is missing in healthcare. So I just want to explain what that means. We've created a system in healthcare that addresses body parts separately,
Yeah.
right? In the realm of healthcare, this system is basically deeply rooted in symptom management.
Hmm.
So we've separated the body into different pieces, and we've created the professions on those specific body parts. But that's not the way that the nervous system functions. In
Hmm.
order to have synchronicity in your from your feet all the way up to your head, from your toes to your head, you need to have the systems that are feeding information to your brainstem. They need to be primed, and that's the feet, the eyes, which affects the vestibular system. And being able to work on all three of those systems at the same time is what is going to create changes in the muscles and in the fascia. So going back to your lady that says every time I train I have pain, well, it means that the imbalances that she has are there, and with time this will only get worse as we age. Unfortunately, we're all decaying by the minute. As we age, we're just, those imbalances are just becoming harder and harder to overcome. Then inflammation, then lifestyle, then pain, then cortisol, and everything else that you then trauma, then right. So everything else that is added on top of that will just make it worse. So what
Hmm.
I'm suggesting is, by again activating the feet, working on the eye muscles at the same time for an extended period of time. What's that period of time? 6 weeks minimum, because that's how long it takes to create new neural networks in the brain.
Yeah.
You're going to have an effect on your vestibular system, which will affect your entire brain and your back muscles,
Hmm.
which will also affect your frontal lobe, which will affect your ability to calm yourself. So this entire again, this entire system is linked. I mean, we can try to separate that system and say, we'll try to break it down into pieces, and see which part works best. But once you address posture, you have an effect on all of those brain parts, right?
Yeah. So you just mentioned will affect your ability to calm yourself, which tells me that you're affecting your sympathetic and parasympathetic nervous system. Do you delve and look at heart rate variability at all?
Oh, absolutely.
Because
Yeah.
I'm wondering if doing this, because it's interesting. I've got a few people, at least a couple in my community, who are physically very active people. They're quite fit. They're reasonably healthy, and they are so stuck on heart rate variability. And they're not that old, and their heart rate variability is in the 20s. Like, it's low, and they are stumped. They don't know what to do anymore. They don't know what breathing to do. They don't know what supplement to take. They don't. And I'm wondering if someone comes to you like this and says, I've got this heart rate variable. I mean, I feel okay. I'm really active. I try to stay in shape. I'm trying to do all the things, and my HRV is in the toilet. What are you going to look at with them?
So again, for me, I'm always going to look at their posture. I'm always going to
Yeah,
look
it's
at, I'm always going
interesting.
to go.
That's where I was gonna go. Yeah.
In order to calm yourself down, you need to have access to the brain parts that regulate the stress response. And
Mhm.
the highest level of brain development is the development of your frontal lobe. It goes back to, how did you develop your frontal lobe? If you have an imbalance in your posture, that's going to create stress in your vestibular system. You're not aware of it. It's not like you're going to have a signal that's going to say, hey, your vestibular system's kicking off. You can have sensations of dizziness. That obviously is a trigger that something's going on, but most people are not aware of it. Now,
Mhm.
what people don't realize is that there's actually 3 stages of autonomic development that are directly linked to posture, from the moment that we're born to the moment that we learn how to walk. And from the moment that we grow our brain. There's an area in the brainstem which, our autonomic system is developed in the same area of the brainstem, the lower part, which is the medulla, and the pons, which is right above the medulla in the brainstem. Again, I don't want to get too technical, but
Okay.
the
We
vagus,
won't.
the autonomic system is developed in that specific part, and this is where the vagus tone is developed.
Mhm.
Okay. And so when we talk about, if we take it back to the beginning and we talk about a baby, in the womb, the first stage of autonomic development is in the womb and is linked to a reflex called the fear paralysis reflex. This is a reflex that basically adults will respond to, or children will respond to, if there's life-threatening situations that will lead us to freeze.
Yeah.
Animals still have these reflexes. Like crocodiles are able to dive down and take their heart rate down to close to nothing. They appear dead because they have a control over this system. As humans, this reflex should not exist. The freeze response should not exist in an adult or in a child. Instead, it gets inhibited by the Moro reflex, which is another reflex that is triggered at the moment that we are born. And that reflex is associated with the activation of our sympathetic system. That's the second stage of autonomic development. So the Moro reflex and the freeze response are both involuntary reactions to stimuli that humans have in their body that are triggered through threat or surprise, or being surprised. Like if you just hear a loud sound, you'll kind of like be startled.
Yeah.
The,
Or a startle reflex in a baby kind of thing.
yeah,
Like
exactly.
that startle reflex, and you shouldn't see that in adults anymore.
You shouldn't. But where I'm going with this, that the point of this entire story is that as we grow, we gain control of our brain, of our frontal lobe, which gives us control through different pathways called cortical reticular fiber pathways, so that the brain can ultimately give us balance between the sympathetic and the parasympathetic system. So
Mhm.
so in an adult, this is extremely important because our emotional state determines where the memories that we retrieve, and those memories are linked to the prefrontal cortex. It's our conscience, and our conscience is our future. So our current emotional state, which is our ability to control and manage our stress right now, can determine our future and our ability to manage our stress. So I don't know if that makes sense or not, but
Yeah.
all this to say that movement activates the brainstem activate those three stages of autonomic development. This happens in a specific sequence through the integration of primitive reflexes, and this gives us the ability as adults, through the pathways that I've just mentioned, to be able to ultimately control our stress through different brain parts, ultimately the frontal lobe.
Right. And so for these people that have seemingly inexplicably low heart rate variability scores, the work comes back to basics. You're coming back
The
to full
basics.
circle to the posture, starting with the feet, starting like engaging the nervous system in a better, healthier way, building new neural pathways.
Well, yeah, because when you engage when you engage posture, you indirectly have an effect on those systems that are regulating heart rate and blood pressure. As a matter of fact, we did a clinical study with 13 the cops in the Massachusetts State Police, where and we had younger ones and older ones on medication, not on medication, and everything in between, men and women. And all 13 of the officers, and the three criterias we were testing was blood pressure, grip strength, and shooting accuracy. And all 13 decreased blood pressure, systolic and diastolic, increased in better shooting accuracy, and an increase in grip strength. So
Just by doing posture work.
just by correcting their foot.
Their foot.
Yeah,
That's so.
because
So
uh,
how important is footwear?
super
It's
important.
gonna be it's gonna be like crazy. Like the person who's addicted to their Manolo Blahniks
Oh
is
my lord.
dead in the water. I mean, it's like
Think of the money. Oh my god.
well, there's the money,
Oh
but
my
quite apart from the money,
yeah.
you know, I mean, when we talk, so I'll tell you a funny story. Like I recently was sent, and I'm not going to name brands, but I was sent these barefoot shoes, and they could possibly rank as the least attractive shoes I've ever worn, because there's a little slot for each one of my toes. I've actually had people look at my feet in horror saying, "Oh my God, what are you wearing?" Like, why would you go out in public like that? And what I found really interesting, and I haven't done any eye exercises or anything, but what I found really fascinating is once I got used to them, which probably took about 2 or 3 days, I struggled to take them off. And I had a knee that was really, really bothering me. And, it was one of those amorphous kind of pains. I wasn't exactly sure where it was coming from, but I couldn't hyperflex it. Like, I couldn't bend. It's disappeared.
Amazing.
Like, the knee pain has kind of magically resolved. And, I'm just thinking about, how you keep coming back to the foot, the foundation of where we stand, and the difference between footwear that allows your foot and maybe encourages your foot to be in a more natural position versus the shoes that we tend to wear, which might look better.
It's a business. It's a business. The problem with shoe wear is that, it goes back to movement. If we prevent a child from moving, and we're going to affect the development of their nervous system and ultimately their brain, if we prevent a foot from moving, then properly, then we are preventing the proper movement of that entire structure, which will affect every single joint above the ankle joint, going all the way up to your head. And that's basically all of the joints in your body, all of them.
Yeah.
So why would one want to do that? I don't know. Again, it's a business. I can understand. Yeah, but it is huge. To go back to your question, it is a problem. It's huge. And it needs to be addressed. I mean, with children in the States, in Canada, women or men could take a whole year off to raise their child, whereas in the States it's 3 months.
Yeah, it's crazy.
So when the child goes to school at 3 months old, we're putting shoes on when they can't even walk.
No, they've got those little bubble feet. They're so cute.
Yeah, they're very cute, but it goes back to promoting that movement as much as possible. So shoes are a big problem. Anything that is going to support your arch is going to be a problem as well, because it is going to cut the proprioception. That's the information from the skin of your foot to your brain. So if we take the skin of the foot and we zoom in on it, inside the skin, there's these different receptors. They're called mechanoreceptors. They feed information to your brain about pressure, about touch, and whatnot. Those same receptors exist in your hand or on your forearm. But the amount of receptors that you'll find on your forearm versus your foot is night and day. They're much, much richer on the foot and the hands, because they borrow a really specific part of your brain in order to allow you to run should there be danger, or use your hands to feed yourself. So the foot is super important. And we can measure this in clinic, where we see how much, let's say I weigh 100 pounds, I should be able to distribute my entire body weight evenly on my two limbs. So I should have 50 pounds on the left, 50 pounds on the right, 25% on the forefoot, and the rear foot should be equal. And if I'm leaning more on one side, then that's going to affect the way that I walk. But again, unless you have a machine in your office or in your house that is able to determine whether or not your body weight is shifted more to one side, you could do the test outside with just simply, testing your foot posture. But most people have an imbalance with that. And that's going to directly affect the line of gravity that passes through L3, which is the lower vertebrae in your lower back, which will affect the way that you stand. So if your static posture is affected, your movement, your dynamic movement will be affected as well.
Yeah, for sure. For sure. Does this, when you talk about the richness of nerves and whatnot in the soles of the feet, does this relate at all to modalities like reflexology, for example? Like you see, if you go into an office of certain types of practitioners, they have the sole of the foot on the wall, and they will show there's a representation, there's a link or representation to almost every organ and different part of the body in that sole of the foot, that I think the implication is linked by the nervous system to the appropriate part of the brain that they're able to stimulate by contact on the foot. Is that a little bit in the realm of?
I'm sure I could find a way to make a link. I don't know much. I love reflexology and acupuncture and auriculotherapy, and what I find that they're great components to this.
Mhm.
I wouldn't be surprised that there's a link.
Yeah,
To be honest, when we think about it, this way, or is it that we're leaning more on one side to address another dysfunction? But I do
or to
feel that
compensate.
yeah.
Yeah.
But I do feel that by activating those different parts of the foot, you can have an effect on anything that is holistic in the body.
Okay. Cool. So in the stuff that you sent me, you were talking about digestive health specifically and posture. And I mean, look, again, like your enteric nervous system, the nerves in the gut have everything to do with everything, but maybe just help us understand a little bit. Because to me, when I thought of that, I was thinking more mechanistically, like if somebody slouches all the time, it's almost like they're physically compressing their organs. So I'm thinking of posture in a more basic way. You're talking about posture really from the ground up in a much more sophisticated fashion. But when you talk about digestive health and it's linked to posture, where are we going with that, and how do people maybe improve their digestion by improving their posture, vice versa?
You know what? Simply through blood flow.
Yeah, so it's the
Yeah.
physical
Yeah.
clearing of your body. Yeah.
Yes, but also, so some studies, I'll take it back to some people, want to hear about studies, but there are some studies that have confirmed that in a standing and sitting position, your heart rate changes.
Yeah.
So if you are standing with a forward posture, then the return blood flow from the calf to the heart is, that flow will be affected. Moving forward is also going to compress your internal organs. So simply through blood flow, you can have an effect on the digestive system. But you can also have an effect through the frontal lobe, and going back to those primitive reflexes, which do involve the nucleus ambiguous, which is a brain part, a brain structure in the brain, which will then have an effect on anything that is below the diaphragm.
Okay.
So ultimately, the simple answer would be good posture affects your breathing and your blood flow. And by improving your breathing and your blood flow, you'll have a positive impact on your digestion. Now, of course, what you eat is also
Of course. Yes.
important. We're not going to exclude that. If you're obviously eating McDonald's every day, there's a factor there that's going to play a role and prevent the proper synthesis or the proper flow of blood. But the idea is that if poor posture can compromise circulation, it's going to affect the delivery of all of the hormones that you need, or uh, the precursors that you need in order to have, should I say, good gut health or good blood
Sure.
circulation in the
Yeah.
gut.
All the things.
Yeah, all of those things.
All of the things. All right. So you were talking about, and I know that you have a lot of resources online that you share with people, and different programs, but we were talking about, maybe we could, you mentioned like easy tips to support immunity and longevity. Like, are there things that people could be doing themselves already at home to either to self-assess, or are there certain exercises, basic exercises that people should be doing that kind of can help them to already start to lay a groundwork and improve their posture in the way that you're talking about from the ground up, using the visual system to inform the brain of where we are, the whole 9 yards?
Yeah, so remove anything that's going to prevent or alter movement.
So those fancy shoes, yes.
If we're going to talk about exercises, before we delve into actual physical exercises, make sure that your body is aligned beforehand, and you can do this by doing simple eye exercises. You can see those throughout my entire social media channels. They work. The trick
Mhm.
is to go slow. People tend to go fast. Going fast will dilute the quality of the exercise. Don't forget that your eyes vision affects 100% of your brain. 100%.
Hmm.
Every single structure in your brain is affected through your eyes. So, the number one thing that we should make sure of is that we have good muscle tension, equal muscle tension, I should say, with the left eye and the right eye. And 9 people out of 10 have a diverging eye, by the way, and don't know it.
That's floating off to one side or
That's
the other.
floating off when you stress it by bringing an object closer at a closer distance towards the nose. It will reveal the imbalance with that eye. So think of the eyes as the steering wheel of the car. Your body is the car. So if
Hmm.
one eye is pulling you out, you're not aware of this, but when you're walking, you're constantly doing these micro adjustments, these muscular micro adjustments to realign your body. And
Right.
at the end of the day, that costs energy. This is why
Hmm.
people are pooped. So, working out your eyes, the shoes, stimulating the skin of your foot. If you don't want to buy insoles, we have different models that are available to anyone that has a different budget. But if you don't want to invest in that, that's completely fine. You can use a fork, a gua sha, anything that will stimulate those sensory receptors under the foot. Make sure to target all of the sensory receptors because some have different functions. So ideally for optimal results, the type 2, type 1, slow twitch, fast twitch, all of those receptors should be stimulated ideally 3 times a day. Same for the eye exercises. Learning to control your stress, that goes back to posture, but that's going to lead to clenching in the
Hmm.
day, not when you're sleeping. Now, if
Yeah.
you have a tendency to have your teeth in contact, let me remind our listeners that your teeth should not touch more than 12 minutes per day. This is when you're eating. They should not touch more than 12 minutes per day. And if they are touching, you are clenching. And if
No
you do
kidding.
clench your teeth, that will push your body forward. So, learning to control your stress, that's frontal lobe, that's posture. You can do that through breathing work as well. We know that breathing and mindful meditation does activate the frontal lobe. There's confirmation of this through MRI. So, not clenching your teeth. And then, ideally, addressing your tongue posture as well. If we have low tongue posture, the tongue is connected to the entire fascial system all the way down to your foot, all the way down to your
Hmm.
big toe. So, proper tongue posture is again something that begins in the early stages of life with breastfeeding. So if it's too
Hmm.
late for you, meaning if you're no longer breastfeeding, there's still things that you can do today to address that. But we try to create tools that don't involve someone's time or try to involve someone's time as least as possible. That's the point of all these tools. Functional activator or therapeutic insoles are just there. It's an investment that you make in a product to make you save time so that it can do the job for you as far as tapping into that neuroplasticity of the brain. As long as we have a healthy nervous system, the body will always react to sensory stimulation.
Hmm.
And the moral of the story is if you want to create long-term changes in your body and your fascia, you must address all of the sensory receptors that feed that information to your brain at the same time for an extended period of time.
Hmm. So, okay, so I wrote down a couple of questions while you were talking. So, when you talk about eye movements and slow eye movements, it reminds me a little bit of a types of exercises that I know people who've had traumatic brain injuries, like any kind of brain injury, have been given it. And I think the name of the therapy is called EM. Is it EMDR?
EMDR,
And
yes.
is that what you're referring to, or are you talking about something different than that?
I'm talking about something different, but EMDR which is recognized, is a technique that is used for people to deal with traumatic stress. And in essence, moving your eyes as you remember the traumatic event helps the person integrate or
Mm,
understand the trauma that they've lived. And this is being done through eye movements. Extremely powerful, by the way. I know that a lot of scientists at the time, I mean, now it's more and more people are talking about it, thought that this was completely bogus,
hmm.
right? But we know
Sure.
we know now that the eyes do affect the brain part. So there's different scenarios that we're looking at here. What I'm working with is triggering the muscles of the eyeball and recreating synchronicity between both eyeballs.
Yeah.
However, EMDR is more of a gesture that does involve the eye movements. It doesn't necessarily correct a diverging or
Right.
convergence insufficiency. It's using eye movements to understand a trauma that one has lived. Very too
Two di-
powerful,
they're parallel but different. Yeah.
but very
Yeah.
different depending on the outcome that you're looking to achieve. So going back to having a weakness of one eye will pull your body in a certain direction. Your muscles will not work in the same fashion from the left side to the right side, and it's going to cause you to waste energy
Yeah,
standing
because you're always
upright.
trying to correct. Yeah. You're always, your nervous system is always firing to correct the
Yeah,
imbalance.
and energy expenditure, they have a term for that. It's called mitochondrial fatigue. Over time,
No
you are
kidding.
depleting yourself of your reserve of energy that you replenish every single night when you go to bed. And
Yeah.
some authors will tell you that mitochondrial fatigue is the cause of all diseases.
Interesting.
So, the eye movements that we perform are specifically to correct a diverging, which is a convergence insufficiency. Now, there are certain conditions that prevents us from doing this. With
Hmm.
Parkinson's disease or any diseases that involve the nervous system, there will always be a disconnect. There will always be an
Hmm.
issue with the eye muscles. Drugs and medication can also interfere, by the way. But usually, when we deal with healthy people, and certainly with children, the corrections happen extremely fast, extremely
Yeah.
fast. And there is a massive benefit to this, because if you can provide your body with consistent anchors, you'll be amazed at the amount of improvement that could come from something as simple as addressing your foot posture or doing some eye exercises.
Well, it sounds huge because if we're talking about mitochondrial fatigue, that, I mean, to your point, that as a root cause will lead to any number of diseases down the road, and or maybe contributing right now. So the other thing that you talked about was stimulating the bottom of the foot. Would walking barefoot on a natural surface do the same thing? Like,
Of
I
course,
mean,
of course.
rather than sitting there with a fork rubbing on your gua sha. I
Yeah,
mean, would it not make sense to, if it's available to you, to walk outside and go walk on the grass or on a beach, or, I mean,
absolutely.
even just walking on the grass. Like, I live in the city. We both live in places. There's no real beach where we are. But finding a patch of grass and walking without any shoes on, or maybe my barefoot shoes kind of don't come too far off, but still there's got to be some magic to walking barefoot on natural surfaces.
There absolutely is, 100%. It's just going to depend on how much time you have. Rubbing the skin of your foot with a fork for 30 seconds is just going to be quicker. Walking outside, I'm not sure you'll get the same. I mean, you'll ground yourself, which is great, right? But I don't know if you'll have the same effect if you just stand on the grass for 30 seconds and then come back in. The idea is you want to stimulate those receptors.
You want to move.
You want
Yeah.
to move them and stimulate a deep layer, a superficial layer of the skin, ideally the fascia as well, because you want to target all of those sensory receptors as quickly as possible to wake up your brain.
Yeah. Well, as someone who's had plantar fasciitis, I'm very aware of the fascia at the bottoms of my feet. I
A lot of
don't have
people are, I think.
I don't have it anymore, but it was an experience, back in the day when we taught aerobics, when it was called aerobics,
Mm.
on concrete floors with no mics. Um, I remember when and actually it was in Montreal, and I got sent to a rehab center in a hospital that dealt mostly with elderly people, and the physio, and this was way at the beginning. Like, I'm not even going to tell people how long ago it was, because then they're going to be like, oh man, she's really old. But the guy, the therapist, the physio who saw me said, like, only old people get
Oh
this.
my
And I
word.
was like,
Thank you.
well, welcome to the new world. Had shin splints
Oh my god.
and plantar fasciitis all at the same time. It was amazing. Okay, so 7 steps to improve your posture. Did you already go through? Is that what you just went through a minute
Yeah, I
ago?
think I think I did. Should we
I think
sum?
you did too.
Yeah, should we sum them up? Are we clear on
Yeah,
that?
let's sum them up one more time.
Okay,
And
so
yeah,
assist me if I forget any. So we said working out the eyes.
how do we do that, or do we need to go to your website to get those
Well,
exercises?
you can go on my social media, but I'm gonna say, just making sure that your fingers right in front of your nose at the level of your eyes.
Yeah.
Yeah, you're doing it right now. That's perfect. And what you want to do is shift your focus to, ideally, I like to draw a line on my fingers so that I have something to focus on. You don't need to do that, but sometimes it's helpful for other people. And then what you want to do is make small circles. So no bigger than this. If you bring your index and your thumb together, it forms a circle. And that's going to be the size of the circle that you're going to do those eye exercises right in front of your nose, in front of your eyes. And you're going to actually move your finger. You could move your eyes as you were doing, but you can, simpler would be to just move your finger like this. See, don't speed up, don't speed up. Nice and slow. And try not to move your head. And you're really just moving. You're
Oh my
really
God.
just,
Okay,
yeah.
that's
So
a lot harder than it sounds.
yeah, so you want to do this when you're relaxed. Obviously, you're not going to do this when you're in a club or in a bar, right? You could do this when or you could. I mean, I guess you could.
You
You
could,
could do
but
it while you're riding a bike, but you'll do it when you're nice and calm and relaxed. And what you want to do is really focus on to yourself and your movements, and how hard it is, or try to focus on the exercise to make it as the best quality as possible. So that's how you do the eye exercises. If you have doubts, there's always my TED Talk where I demonstrate them live on stage, and if not, tons of information on my social media that you can find. So there's eye exercises, there's fixing your posture, there's your shoes, making sure that you don't wear crappy shoes, stimulating the skin of your foot. Did I mention your tongue posture?
Yeah. So what is my tongue posture? Should it be up against the roof of my mouth or against my teeth
Should
or?
not be against your teeth at all.
Okay.
It should not be pointing this way either. It needs to be flat on the palate and should not touch your teeth.
Okay. That feels like a lot of work.
Right, but if you when you're in bed, if you just take a moment and practice, most people tend to find the position of the tongue, and then not clenching your teeth. Did I mention
And
that?
then the teeth not touching. That was really important because we talk to people about not mouth breathing, and it almost seems counter to that, right? So you want your lips together but your teeth apart. Holy jumping. So your lips together, your teeth apart, and your tongue flat against the bottom of the mouth.
Yeah. So imagine if we did that with kids at when they're developing their mouth and their teeth are growing, right? Children start to grow, they start to lose their teeth at 8, 9, 10, 12 years. So imagine if we start to adopt these methods with children as early as 3 years old. You give them a chance to have proper tongue posture. If you have proper tongue posture, you will not need braces. No
Hmm.
braces. By the way, this is a huge industry that we're
Yeah.
talking about, right? You don't need braces. The wisdom teeth should erupt naturally. You should have a full development. The palate, the maxillary will be nice and wide. This is going to affect facial structures, right? As we use our teeth and our mouth and we chew really hard food, it helps us develop the musculature of our face, which gives us our facial features. And then that's going to position the temporal mandibular joint where it needs to be, which that's your jaw joint,
Mm-hmm.
and that will promote natural nasal breathing.
Hmm.
So
Interesting.
if we started with children, as early as 3 years old, and I'm not talking about putting braces, well, they don't have teeth, but just with simple tools and appliances, because it will be challenging for a child to, you're not going to tell a 3-year-old put your tongue on the top of your palate. You need a tool to do that for them when they're sleeping. And that's why we created our device, which is called the functional activator, which is available for children and for adults.
Really? So you would like any child?
Oh yeah, my children. So what I would do when they were sleeping, I would just sneak into their room. I make it a game with them. They wear theirs, I wear mine, and we kind of go jogging and we create like kind of like a positive event from it. And then when they would go to bed, I would just sneak in with their activator and shove it in their mouth and they just like immediately cling onto it, lips closed, and just sleep through the night, and that's it.
Really? And does that for adults, does this have an impact on snoring at all?
So we've seen, not for everyone, but we've seen, and there are counter indications depending on which condition you have or whatnot. But we've seen an improvement in snoring with adults as well. When you position your tongue up on the palate, you open up the airway.
Mm. Okay. Which is a good thing. Okay, so we've got fixing posture, eye exercises, shoes, skin stimulation, the skin stimulating the skin at the soles of the feet, flat tongue, the teeth are not touching. Is there one more?
Stress reduction.
Stress, of course. Stress reduction.
And now you're ready to be healthy.
And now you're ready to be healthy. And so the downstream effect of all of this is ultimately that the nervous system is more balanced. And with a more balanced nervous system,
A more balanced life.
everything follows from there.
Everything follows from there. Exactly.
That's really interesting. Annette, this has been fascinating. Thank you so much. Where can people find you? You mentioned a TED Talk. Is there a name? How do people find your TED Talk? Because I embarrassingly haven't listened to it. I'm going to be checking it out right now. Because I want to see you doing that eye exercise. And then also your social media and then your website.
Website is posturepro.co. And that is the same handle for all of my social media channels, Posture Pro. And you can find my TED Talk on all of my social media channels or just by Googling my name, Annette Verpillot, and putting right after TED Talk, and I will pop right up.
Okay, so we'll put all that in the show notes, and also for those of us for the audience that are not French speaking, we'll spell out Verpillot because otherwise they're all going to be sitting there scratching their heads, going, I know it starts with a V, might be an ER in there and a P, but after that I'm lost. So we'll help people out with that. So thank you so much, Annette. This has been really fascinating, and I appreciate your time today.
Likewise. Thank you so much.
Thank you. Okay, guys, we're back. So here's the thing. My guests and I often joke about the discussion we had before the podcast. Well, in this case, there was a discussion we had after we finished recording, and the information that Annette is sharing with me right now, I think is so on the money and so profound. We turned the mic back on. We're recording again, and there's just two populations we're going to talk about right here. And this really brings the message home so powerfully that I just felt it was important for us to get back on and share this with you guys. And we kind of alluded a little bit to the importance of this kind of work for children and athletes. Let's start with the kids. We were just talking about how you see so many children who have an eye that's wandering off one way or another, like they have a divergent eye, I believe it said. And so my question to you was, isn't that going to somehow have an impact on their ability to learn? And your answer kind of blew me away. So if you're a parent or you have a small child in your life, you need to listen to this, because I feel like the number of kids that are being diagnosed with, whether it's ADD or ADHD or some kind of learning issue, and nobody's looking at this stuff, it blows my mind. So if you would just share a little bit about what we were talking about, that would be great.
Yeah. So what I was saying is that in practice, in my clinic, every single child that I see has a diverging eye. And this is something that could be very easily, any parent, all you have to do is grab a pen and put it on your child's nose and ask them to look at the tip of the pen. And what you're looking for is to figure out if there's one eye that's actually not focusing and not following the tip of the pen. If you find that one eye is diverging or if they have a convergence insufficiency, you must address it right away, because it's going to affect the way that they read, the way that they speak, what they understand, their understanding, their cognition, the way that they speak, their emotion, the way that they stand, the weight bearing. If a child puts their entire body weight more on one side in comparison to the other, you are going to stunt the growth of one side, which leads to an imbalance in the pelvis and the spine, ultimately even a leg length discrepancy, which leads to lower back pain, which leads to $54 billion of healthcare per year for taxpayers. But the point is that with children, it's massive, and you can fix this. You can address this diverging eye with simple eye exercises. The amount of time that it's going to cost you to do those exercises in comparison to the amount of time that you will save later on in just stress management and schoolwork and homework. I was telling you that I have pictures and testimonials of parents that cry. They tell me they spend hours and hours of homework every night with their kids, 4 hours of homework down to 30 minutes, simply
Wow.
by correcting the feet and the eyes. We have writing where their writing improves simply by improving their posture.
Wow.
So there's a direct link between, I've seen it, I've seen it so many times with a child's posture, their emotions, their ability to understand emotions, and their cognition and everything else. So the moral of the story here is, a simple test: look at the tip of the pen. If there's a diverging eye, if your child is under 16 years old, you can still do something about it and create massive life changing results for that child
Well, and you can do it if they're over 16 too. It's just
as
going to
well.
be, it'll just take
Absolutely.
longer and be harder. And then there was the story of the professional sports team.
Yes.
So I'm not going to out the name of the team unless you want to share it. I don't know what your deal is with these people, but this is a football team, right? A
Yeah,
college
so no,
football
it's the
team.
Florida Gators, the basketball. It is
Basketball.
on my social media, and basically what I was telling you is that the university is always looking for these different ways to help their players, and one of the tools that they had acquired at the time was a machine that would allow the players to simply do some really fast eye tracking eye exercises and peripheral vision with the intent to improve their shooting accuracy. But what we had noticed when I was called in is that although the players were consistently going through the series of visual exercises, they all had a diverging eye.
Hmm.
So, and this machine was extremely costly for the university, and I was stunned to, again, through simple exercises. I've done videos, they're on my social media, where you see me doing those eye exercises with those athletes, which would be the same for anyone really, just to restore proper convergence. So it goes back to saying that with a very simple exercise, which the method that I've developed, which again I give a lot of tips for free, allows me, with a healthy person, it's, varies with everybody's nervous
Mm.
system is different, to sometimes correct a diverging eye in less than 30 seconds. Of
Wow.
course, there's medical conditions like being strabismus, like having a stroke, like cancer, like, right, there's different conditions that will prevent me from doing that. But with a healthy population, 30 seconds. And then repeating those exercises, it's going to cost you 3 minutes per day. Compared to what most people, from what I'm told, compared to the time that is invested by most people, a minute and a half to 3 minutes per day is no time at all.
Well, it's nothing.
Nothing.
When the other thing that you would mention, because I had said, well, is it possible that these athletes have these diverging eyes because of brain
Oh, yes.
injuries?
Mm.
And you said something really interesting about that too. Again, I was like, oh, okay. That's when I said, okay, we got to turn the mic back on.
Yeah, so here's the thing: if someone is well balanced posturally before any type of an injury, it's not just an athlete, but since we were talking with athletes, and let's say an injury will occur and will happen, like having a concussion, being properly balanced and having proper posture prior to the injury actually helps with the speed of the healing process, as
Yeah.
opposed to going or having a concussion with eyes that are hypoconvergent, with a convergence insufficiency, postural imbalances, and a whole bunch of postural issues. It will be much harder for the athlete or anyone to recuperate from that state. So
Yeah.
the idea is that if the injury is inevitable, so be it. At least make sure that, our goal is to make sure that the athlete or that anyone is well balanced prior to any traumatic event. And that
Yeah.
that also, that now that we talk about it, this would also go for any traumatic event to begin with,
Mm-hmm.
right?
Even emotional.
Even emotional, absolutely. Because what will give you the ability to um, stand up to those emotional, or understand those emotional circumstances that we cannot control ultimately, is the ability of your brain.
Yeah. Yeah. Well, and as you talked about earlier, if your nervous system is not continually being activated, trying to rebalance an imbalance, it's possibly has more resilience available to it to deal with some kind of a trauma.
I think you're going to come and work for Posture Pro. I love the way you just said that. Exactly. You nailed
Yeah.
it.
Yeah. Okay. Well, on that note, that's what I wanted to share with you guys. I just think it's just so, I mean, you encapsulated in those two examples so much of what we were talking about earlier, and just makes it, I find it just really concretized for me the concepts of what you're talking about. So thank you for the extra time, Annette.
You're welcome.
We will, all the resources are in the show notes. And thanks everybody for sticking with us. Have a great day.